Next, let's welcome Dr. Joshua Winslow of New Hanover Regional Medical Center Physician Group, Cape Fear Heart Associates. Dr. Winslow, thank you so much for being with us today. It's just a pleasure to have you, and I'm really excited to learn about you. I understand that you recently joined New Hanover Regional Medical Center's Cape Fear Heart Associates. Is that correct?
I did. I just joined, and I took over the Brunswick office, and I'm working at the Brunswick Medical Center and as the cardiologist for Cape Fear Heart.
Right, and you're now on our official medical staff at Novant Health Brunswick Medical Center, so we're excited about that.
So am I.
So, so our viewers can get to know you a little bit. Let's share with us your education and some of your background and your experience.
I went to college at Hobart College in upstate New York, where it's very snowy right now.
Yes, it is.
Graduated with a Bachelor of Science in Biology, and I applied for medical school, and I went to Jefferson Medical College in Philadelphia.
Nice. Yeah.
And I did a scholarship program to pay for medical school, the Health Professional Scholarship Program with the Army. So I did my training in the Army, so I went to Hawaii, Triple Army Medical Center for my residency.
Oh, that was a real, that was hard, wasn't
My
it?
wife really enjoyed it. And then I did my cardiology fellowship at Brooke Army Medical Center in San Antonio for 3 years. And then I did my 5-year payback as a cardiologist in the Army at, in El Paso, Texas at Fort Bliss.
Wow. Wow. And did you come here directly from Texas?
No, I did private practice stint for 12 years. I ended up on Jersey Shore near Red Bank and practiced there for 12 years, and now I'm transitioning down here.
So you like the shores, right?
I do.
You were from the Jersey Shore to the North Carolina shores.
I do. It's very, it's a great quality of life.
It is a great quality of life here. It's just a wonderful place to live. So tell me a little bit about your clinic.
So I work in the clinic right across from the hospital at Brunswick Medical Center
it's right on our campus.
Right there, walk just 200 yards away.
That's great.
And my office is fully staffed. We have we do all our non-invasive imaging there, our nuclear stress tests, all our echoes and vascular studies, including carotids and abdominal aorta studies. We do, and I see my patients there. We have a device clinic there. It's pretty much a full-service office.
And you're at the Brunswick office full-time?
I've been hired full-time to take over that office.
That's wonderful. Oftentimes, there might be an opportunity where there wasn't a cardiologist there. To have somebody there full-time is great.
Right, full-time. I do half day in the office, and I go over and round in the Brunswick Hospital and manage the inpatient service there too.
That's awesome. And you work with the hospitalist team there?
Yes, I do, on a daily basis. I see them more than my wife.
Do your partners also see patients in the Brunswick office?
I've replaced a lot of the slots from the people that used to transition down there, so it's primarily me. We do have once a week an electrophysiologist, subspecialist, an electrical doctor, come down and provide service in our expertise once a week. So that's very helpful.
Is that the same electrophysiologist?
No, we have. I think we have 5 or 6 of them, and at least 4 of them rotate through there on Mondays, and that's a big help because that way you don't have to drive to Wilmington to get your specialty care.
Right. Yeah. Let's talk a little bit about the services offered. I know you went through those quickly, but if we could do that a little more detail. About the treatments that you can provide there at your office.
The office, full non-invasive stress tests, all the sonograms, there are echocardiograms of the heart. We have, if you have a pacemaker or defibrillator, we have our device checks there.
Okay.
And then I see my patients there too, obviously. Yeah.
Yes. When you say device checks, does that require a patient to always be with you or on site, or can it be done telephonically?
Well, they're done mostly telephonically unless it's a new device. We check it in person, and then at least once a year you have to come in for a in-person check when you have a device. So most of it's done telephonically, but we do have in-person checks at least once a year.
How about testing at Novant Health Brunswick Medical Center? Is it possible for patients to get their necessary testing there at Novant Health?
Absolutely. All the same tests, all the nuclear stress test, echocardiogram, and all the same non-invasive tests, the carotids and the abdominal ultrasound tests are done there. And I I perform them for the hospital with my nurse practitioner and read them. So the same outpatient tests are available at Novant, and then also on the inpatient side, I've come in to bring some more cardiovascular care opportunities there, and one of the things is I'm implanting loop recorders, which is a recording device. It's just underneath the skin, and it's a simple procedure, but it's like a Holter monitor for 3 years. We use that specifically for people that had a stroke for no reason. And the reason why we implant it is because we're looking for atrial fibrillation, which can cause stroke, and it can come and go. And about 30% of the people that have stroke for no reason, it's called cryptogenic stroke, will have atrial fibrillation.
Oh.
And then it'll be a major change because you have to fully anticoagulate, not just platelet blockers, aspirin. You have to give them blood thinners to protect you from recurrent stroke.
On one occasion, I had to wear a Holter monitor, I think for like 24 hours or something. So this device that you implant, it does the same thing, but for a much longer period of time?
Right, and it's mainly for people you can't figure out. Obviously, you do the non-invasive, the monitoring. You have, 1 month event monitors. But if you've had a stroke, we're a little bit more aggressive if nothing's showing up and you need longer monitoring. Or for people that pass out every 6 months and we don't know why.
You don't know why.
So it's very helpful. We brought that to the hospital. I'm also going to be starting a cardiac catheterization program at the hospital.
I heard a little bit about that actually just this morning.
Yeah. So we're going to start on a limited basis, outpatient cardiac caths. It's going to be in a mobile laboratory attached to the hospital. And then my plan is to build on that for the next 5 years.
Wow, that's great. That would be great. Well, today I wanted to talk a little bit about some health tips. I wondered if, I know I'm concerned about my heart, and I think most of our viewers are probably concerned about that. So let's talk about some health tips. What would your top recommendations for preventing heart disease be? I
think just starting. I think that if you're overwhelmed and you're not exercising, if you're smoking, you gotta start concentrating on the things that you're doing wrong. It doesn't have to be all at once.
Right.
So if you're smoking, number one recommendation is there's plenty of help. You can talk to your primary care doctor and get a plan for quitting smoking. Two. Diet, you can start simply with just if you drink soda with sugar in it or sweet tea on a regular basis, get rid of the sugar.
Get rid of the sugar.
And don't drink the soda. I've seen people lose 25 pounds in a year by just cutting out drinking soda, sugary soda.
Wow.
But of course, diet and exercise, regular exercise and diet. And I think that people that are at home and they haven't been taking care of themselves, they look at these the advertisements for the models on the treadmills, and they have 0% body fat, and they said, "There's no way I'm going to start that." But I think simply just doing stairs, starting out with a walking exercise program, and then a low-fat, low-cholesterol diet.
Wow. Yeah, I would agree with you. I think you just have to set your mind to making small changes and then working on those.
And build from there. But as far as specific diets, I recommend a book by Dean Ornish, How to Reverse Heart Disease.
Okay.
And you can also see some lectures from Dean Ornish. He's the leader in preventative diet for reversing coronary artery disease.
Really?
You can actually reverse coronary artery disease with his diet. It's a very...
Is it like the Mediterranean diet?
No, it's a specific plant-based diet.
Plant-based,
and,
okay.
And it's, for reversing coronary artery disease, it's pretty restrictive. But, you can go online and to TED Talks, TED, TED Talks. You can see Dean Ornish on some of his lectures, and you can get his book. Also, Michael Greger wrote a book on how not to die.
How not to die.
And,
I'm going to take note of these.
Yeah.
I'm going to look these up.
But the plant-based diet's the best. Not everybody can do it, but if you read the books, you get an understanding of what you need to cut back on at least, and try to emulate the diet as best you can.
Right. Well, that's all great information. Tell our viewers how they can make an appointment with you.
Well, our main appointment line is 662 9500. And if you're in Brunswick County, ask for the Brunswick County office.
Right.
And Dr. Joshua Winslow. I have a brother up in the main office in Wilmington, Timothy, so make sure you say my name. But I think that, yeah, you call that main office number, and of course your primary care doctor can refer you to me also.
Yeah. Well, thank you so much for being with us today. It's been a pleasure, and I look forward to seeing you on campus.
Great, June, thank you.